So Dr. Hashemi Sadraei, she conducted this study in head and neck cancer, as it's very important in head and neck that we look at quality of life. So in head and neck cancer patients, when they receive chemotherapy and radiation, a lot of them undergo a lot of adverse effects, such as stiffness of the neck, difficulty swallowing. A lot of them wind up needing feeding tubes. And so for studies in the future, for us to conduct these studies, it will be important for us to look at quality of life in these patients and studies that we do, especially using new treatments such as immunotherapy, which has promise in reducing these side effects. So what she set out to do in this study was to ask, okay, let's see if this is even feasible in our patients. So she used certified quality of life surveys and conducted this survey with a lot of different patients that are undergoing chemotherapy and radiation. And what she found was that both what patients answered on these surveys versus the adverse effects they seemed to experience clinically that we could observe seemed to correlate. So in other words, if a patient said they had difficulty swallowing and they were able to grade that on the severity, a lot of those patients also wound up with feeding tubes. So it correlated. And so what will be important in the future, as I mentioned, she will be conducting a laryngeal study that will look at adding immunotherapy to this regimen. And the question is will we be able to impact the quality of life? In other words, can we reduce these adverse effects that we get from chemotherapy and radiation by adding these other immunotherapies? And will they actually impact have a better quality of life?